room or a hospitalization that could have and frankly should have been prevented, but isn't, because people aren't able to access a primary care clinician, or they don't have health insurance, and so are getting their care in the most expensive part, or one of the most expensive parts of the system, emergency rooms, instead of clinics. And so that's a pattern that needs to be broken. Because it's not good for anybody, and it's not good for the person who's being treated maybe a week later and then put into the hospital when perhaps an antibiotic at a clinic could have prevented all of that and the associated costs from unfolding. So it's reforming this healthcare system is critically important in getting it right for the population. There's no question, and for our communities across the country, for everyone.
Yes. And finally, one size won't fit all. The physicians will be able to look at the patient, make an assessment, order the appropriate tests, and compare that with past tests. And it simplifies it so very much, rather than calling the insurance company, waiting 2 or 3 days to see if they can do a test. Often, especially if you have to do that, patients are sicker. Sometimes you might even lose them during that waiting period, or whether you can do an additional test. That it will be such a relief for a practitioner, and I believe that we'll have more people interested in going into the practice of medicine.
Well, for any of your young viewers out there today, I can assure them that the Recovery Act, the stimulus funds that Congress passed and the President signed, has put a significant amount of money into preparing the next generation of healthcare providers, a healthcare workforce. So if you have any young viewer out there that's interested in nursing, dentistry, so for oral health, to become a physician and so on, the resources are there in ways that they have not been for years.
That's right.
We're going to need that healthcare workforce. For people who want to change jobs, maybe they've been doing something else, they can sure think about a healthcare career. The U.S. Department of Labor has recently released statistics projecting high-need areas, and that is one of the areas they're projecting great need in. And the federal government is trying to step up to the plate and help with scholarships and loans and loan repayment programs. Thanks to the stimulus funds, those new jobs will be available, and education will be available to folks that would not have necessarily been there at all prior to that bill having been passed.
That's right. And you know, I have not heard of any healthcare worker without a job. They all can find a job, because we'll always have people to take care of. So even now, the ads that you see in the paper advertising for jobs have diminished quite a bit, but not in the health areas. For the laboratory technologists, for nurses, for aides, there are needs all over the country for these skills. And we'll have an additional need when we really start focusing on teaching people how to take care of themselves. So this is a great time to consider career change. If people are in careers they feel that talent has kind of gone by the wayside. We say a lot of times that it's been going overseas because of trade. Actually, the technology has replaced a lot of those positions. And they won't be back, because technology will be doing that job. But technology cannot do all of that personal care for patients.
It is a mix, isn't it? It takes some of both. Technology can be a great extension, but that's what it is. It's an extension. We're seeing technology used now, and when you were talking about mobile clinics earlier, well, we're also seeing technology right in patients' homes, so that a home health nurse, for example, doesn't need to drive 50 miles every day to check on, the weight and blood pressure and pulse of an elderly patient who might be living on a ranch in West Texas. But instead, more and more, we're seeing technologies applied that extend the reach of a doctor or a nurse out to those folks who don't want to have to move into a community for a period of time as they're getting better. So it's not to replace one, it is to extend the reach, I think, and that's an important investment.
Yes, as a matter of fact, that is one of the many products that has come from space exploration to come up with that technology. Someone can be looking at that patient by technology and telling him exactly what pill to take at what time. Get that bottle over there. It's a yellow pill. This is one you take. They check on them each morning, and no one has to make a step away from home nor away from an office or a facility. So we're going to be greatly served by people and technology working together.
I think so too, and the next generations coming up behind us are pretty comfortable, I think, with technology. They grew up with computers. This is not a foreign way of engaging at all. So I think they have a high comfort level, and which is terrific, because it would allow us then to leverage those technologies even more. We see in some of our rural areas of the United States psychiatrists outreaching telepsychiatry. To hard-to-reach areas and communities, dermatologists who can see skin lesions and can engage in diagnosis and interface with a patient that way. So there's a lot of opportunity there, and some of the telemedicine initiatives are actually funded. We have some funding streams through the Health Resources and Services Administration to continue to push forward on those technology applications to drive more efficiency. If a doctor doesn't have to spend a lot of windshield time driving 50 or 60 miles every day to a clinic, but rather can be accessible using technologies, that's an efficient use of resources.
Yes, and you know, it cuts out a lot of waste. It'll be very difficult to use fraud, because the record will be there for the persons intended to see them. They'll be there for them to see them. So it's exciting to think about what we could get with this major piece of legislation. We'll get it in motion, and then I think 10 or 15 years from now we'll say, why didn't we do that sooner? Because it really will make a difference. Now, it's going to change some things. It'll change and get more competitive for insurance companies. It'll probably get more competitive for pharmaceutical companies, and the people that sell all these very expensive exotic machinery, they will be challenged because we'll be using more efficient ways to share the very expensive equipment from facility to facility. But in the long run, all of our consumers benefit, and because their health will be in better hands with more knowledge about their conditions, and they will know more about themselves by having access to the community health centers to get instructions to see exactly how to take care of themselves, and to empty these emergency rooms for coughs and nosebleeds, things that people can really take care of themselves if they just had that knowledge. So I look forward to the day. I hope I'm around to see it implemented, because I know that we'll see a new day in the delivery of health care, and it'll be so much more efficient and so much better for the patients.
There is a lot of room for improvement, isn't there?
It really is.
We have some great health care out there, but it's spotty. It's far too costly. It breaks the banks for businesses, for small businesses. It breaks the banks for families when we're seeing, in many cases, double-digit increases in premiums. We can't sustain that trajectory. So it's the car's got to be turned onto a different highway, that's for sure, and one that will take us to much better health care and investment in illness prevention and health promotion, which is a lot of what you're talking about.
Yes, and it will take change. Change is hard for us as Americans, but it takes change. Be a part of that change, and we'll talk with you again next week. Thank you so much for coming.
A pleasure.
This has been another edition of Report from Washington featuring Congresswoman Eddie Bernice Johnson. You can reach Congresswoman Johnson at 202-225-8885 or 214-922-8885. You can also contact her through her website at http://www.house.gov/EBJohnson.